Hi, everybody. This is Linda. I'm one of the nurse practitioners here at Dayton Outpatient Center. So I'm going to be talking today about all the medications that we use apart from the opioids. Uh, Reason I wanted to do this talk is I get questions very commonly about why can't I just take one pill? Why do I have to take three different medications to treat my pain? And so there's a reason for that. So I just want to talk about that. We'll talk about adjunct pain management. Um, what we want to accomplish today is we want to understand what defines chronic pain, the risks of depending just on opioids or long term opioids. And we're also going to talk about safer and sometimes more effective treatment options. So, what is chronic pain? Chronic pain is pain, any kind of pain that lasts for longer than 3 months. If you've ever noticed, if you've ever had surgeries, surgeons will prescribe for a few weeks up to about 3 months, and then they will turn you over to a pain management group such as DOC. Chronic pain, it tends to be persistent even after the injury heals. So if you've had surgery but you have ongoing pain, and that's actually pretty common in back surgery and neck surgery. Chronic pain can involve nerves, it can involve your brain, or even just can be ongoing inflammation. And inflammation is one of the major drivers of pain. Common examples of chronic pain are back pain. And again, despite having back surgery, you can have arthritis, and arthritis definitely a major driver of ongoing chronic pain, such as knee pain or hip pain. Nerve pain can definitely be chronic. And examples of nerve pain that are chronic are things like shingles. Uh, So, why do we want you to take medications apart from just one pill, one opioid? Because oftentimes opioids don't really totally treat the underlying cause of your pain. They can be effective, but we would have to prescribe really high doses to effectively treat your pain. Um, and opioids, unfortunately, in the short term they work really well. The longer you're on them, sometimes your response to the opioid decreases and you require higher doses. The higher doses, then you run the risk of dependence on the medication, sometimes even addiction. Opioids in higher doses can cause an increased risk of falling and injuries, therefore. Some people get real dizzy and lightheaded from opioid medications. They can reduce your alertness, which again predisposes you to falling. They also cause constipation and nausea sometimes. Constipation is a big issue with opioid medications. And there are a number of stool softeners as well as laxatives that you can take for the pain. Drowsiness is another issue. And like I said just a little bit ago, reduced alertness. So again, that predisposes you to falling. You may not be completely aware of your surroundings and you can trip on things while walking through your house. And then always cognitive impairment. Long-term opioids actually result in changes in your brain chemistry, and that can affect your ability to process things and to think clearly. The other thing that's really concerning is on the government keeps track of the causes of death. And in the United States, overdose is one of the leading causes of accidental deaths. So something to be concerned about and monitor. So, what are adjunct treatments? So, these are pretty much all the things we use apart from the opioids. Um, these options, they can act directly on inflammation, like anti-inflammatory medications. They can act on the nerve, like gabapentin or pregabalin. They can actually also affect your psychological uh, views of things and make you feel better, which helps you to tolerate pain. They're often safer, although not always. But again, we just want to monitor for side effects. So, to talk about the specific medications, NSAIDs are non-steroidal anti-inflammatory drugs. That's what NSAID stands for. So, a good example of this is ibuprofen, Motrin, Advil, Aleve, naproxen, meloxicam. Those are all commonly used. The Just like the name says, the uh, drug itself works by reducing inflammation. And by reducing inflammation, which is commonly a generator of pain, it helps with joint and muscle pain. So NSAIDs are really good for like arthritic type conditions like knee arthritis, hip arthritis, shoulder arthritis. Acetaminophen is kind of in its own class. It does not reduce inflammation. It has no anti-inflammatory properties. However, it's very commonly used and very effective at reducing pain and fever. And in fact, sometimes works better if you take it on a regular basis rather than as needed. Other medications that help reduce brain and nerve pain are medications that make you feel better. So the SSRIs or serotonin inhibitors, things like Cymbalta, Effexor, Seroquel, those are some of the examples. These medications kind of turn down the volume, if you will, of pain signals. And they're work really well, again, as one of the strategies of treating pain. So antidepressants are also very commonly used. Things like amitriptyline and Cymbalta, they help to adjust brain chemicals that affect pain. They also help to reduce chronic and especially nerve-related pain. And so we use them not just for mood elevators, for depression, so to speak, but also for pain relief. And again, because it makes you feel better overall, and that just helps you tolerate the pain better. Anticonvulsants are commonly used as well, such as gabapentin, pregabalin, and these just help to calm those nerves down so the nerves don't send those pain signals. They help with burning, tingling, shooting pain. So this is very commonly experienced with neuropathic or neuropathy pain. So they're very helpful for that kind of pain. Topicals are great as well. We use diclofenac ointment. We also use lidocaine patches. So these types of pain strategies are topical. They work locally at the site where they are applied. They're better for some types of pain than other. For instance, knee pain, some people do use the Voltaren or diclofenac gel and find that it works well. But the knee joint is pretty deep and it's hard to get enough pain medication down into the knee joint to help significantly. But if you have arthritic hands or if you have tennis elbow, it works really well there. Steroids are also used, and that's what we use when we give you the injections We give you a little bit of numbing medicine as well as steroids. Steroids reduce inflammation directly. They're very potent anti-inflammatory medicines. Um, so these actually can be used topically, though they're much more effective by injection. We also use muscle relaxants. Muscle relaxants help to reduce muscle spasming. So things like cyclobenzaprine or Flexeril, methylcarbamol is another example. These help with your mobility and comfort. And the more mobile you are, the better off you're going to be and the less pain that you will have overall. Uh, Generally, muscle relaxants can be used short term. We do have folks who are on them long term. So other types of non-medicinal type of pain medication or pain strategies is just applying heat or cold. Some people like heat, some people like cold. You can do a combination. There's no right or wrong to this, whatever makes your pain feel better. Generally, ice reduces inflammation and swelling. So inflammation, again, with accompanied by swelling, can really aggravate pain. So if you reduce the swelling and the inflammation with ice application, then the logic is that your pain will be better. For folks who have arthritis, generally arthritic joints like to be warm, so heat might be a better choice. There are mind-body techniques like relaxation techniques where you just sit and kind of meditate. Deep breathing is also very effective. Generally, we are here to help you, and we want to find out what works best for you. What may be very effective for one patient may not work at all for someone else. So one of the things that's really important is for you to communicate with us and let us know what is working for you and what is not. If when you get home and you start taking your medications, you discover, gosh, this medicine doesn't really work as well as this other medicine that I used to be on, or if it's not working, just talk with us at your next visit. Everybody's pain and everybody experiences pain differently. So there's no single answer. We just want to make sure that you're getting all the pain relief that we can. We will work with you, and our plan for you is not carved in stone. We'll adjust medicines. We'll add or subtract if we need to so that you get a good pain relief. Often the plan will include medications. It might be these physical approaches, topicals, heat. We might prescribe physical therapy. Therapy can be really good and strengthening, is very effective in relieving pain sometimes. And then there are also lifestyle and relaxation strategies that we may utilize. Basically, we just want to maximize relief and minimize the risk of the medications and potential side effects. So your role is stay active whenever possible. Your body was meant to be mobile, and so the more you are moving around, the better off you will be. Follow your medication instructions carefully. If you take them differently from what we prescribe, then talk with us about that. There may be a reason why we want you to take them in a certain way. So just always communicate with your provider. We're here to help. We're not here to dictate a pain regimen to you. And write down at home what works and what doesn't work for you. and we can help you figure out why did that work, why did this not work, and what we can do differently to give you better pain relief. You can always contact us through the portal by sending a message. You can also leave a phone message with the medical assistant. Whenever the pain seems to be worsening, just let us know. If you have new symptoms, especially if you suspect that the symptom may be a side effect of one of the medications, let us know. And any questions that you might have about your treatment plan, especially about how to take the medications. If there's questions about, why can I only take it twice a day? Why can't I take it 3 times a day? Or whatever the question is, just communicate with us. That's important. And any questions, please send to info@DaytonDOC.com.